her review my results. And I have some other things I would like to talk to the doctor.
May I ask what the other issues are that you'd like to address?
I just rather be it for the doctor.
Oh, I'm sorry. Silly me.
Is it good?
It's fine. It's not high or anything.
Oh. What's that, my temperature?
97.3, that's fine.
Oh.
Now, do you have any allergies to any medications?
Yes.
What type of allergies do you have?
I'm allergic to, I forgot the name of it. It starts with an A.
Okay. You're not sure what it is? Okay. Are you on any medication?
I am.
Did you bring your list with you today?
No, I forgot it.
You didn't bring a list?
No.
You don't know what you're allergic to?
No.
Well, can you tell me more about why you're here?
Well, I know that she's going to review these results for a test I had. And she said that I want to talk to her about something.
Okay. I will let her know. The patient was really vague about what she wanted, didn't want to really open up, doesn't know, didn't bring a medication list, didn't know what she's allergic to. I mean,
Okay.
it's just, I don't know.
All right. Okay. Hi, Joyce.
Good morning, doctor.
How are you?
I'm good.
Good. Okay. So first things first, we want to talk about your colonoscopy. Okay.
Mm-hmm.
We sent you for your colonoscopy because you were having some signs of anemia. Okay. We tested your transferrin and ferritin, and your hematocrit was really low. So we went ahead and did a colonoscopy with a scope and looked inside to make sure everything was okay. They did not find any, they did not have to do a polypectomy, they didn't have to take out anything. So there was nothing in your colon that was suspicious for malignancy.
Oh my
okay?
God, it sounds bad.
It's not. You're actually fine. Okay? So remember, the reason why they do colonoscopies is to look for cancer. Okay? But they didn't find any malignancies in there. Okay?
And malignancy means...
Malignancy is cancer. Yeah. Okay? But you don't have that. So we also look for, one of the other things we look for is like blood or hemorrhaging or arteriovenous malformations or any other thing that can cause bleeding in the bowel. But they didn't find anything in your lower bowel. Okay? Which makes me think that we should probably find some different causes for your anemia. All right?
Said a mouthful, but okay.
Okay. So when we talked last, we hadn't really started you on any medicine or anything like that. What I'd like to do is I'd like to think of some other causes of your anemia. Okay. We need to do an EGD. So I'm gonna send you back to the GI doctor, and he did not do an EGD as we would have liked. So we're gonna go ahead and schedule that. Okay.
EGD.
Yep. It's EGD. It's esophagogastroduodenoscopy.
Oh Jesus.
Okay. So we're gonna do that, and if they see anything in your stomach that's a concern to them, then they'll take it out with a little tiny piece of.
I'm gonna have to call my husband. This is
a tiny piece. I'm sorry, I don't mean to overwhelm you. A tiny piece of your stomach. Make sure that there's nothing in your stomach that's causing your bleeding, and also just take a quick survey and make sure that your stomach looks okay. All right.
Oh wow.
Also, we'd like to look at some blood work and make sure that you may not have an iron deficiency anemia, but you might have other causes for anemia, so we're gonna take a look at that as well, okay? But for right now, you know, we are gonna start you, for right now, the suspicion is that it is iron deficiency anemia, so we are gonna start you on iron pills, okay? I'm also gonna give you some Senecot, which is gonna help with stool softeners, because iron pills can make you constipated, okay? But I want you to take them every day,
Wow.
okay? So, why don't I go ahead and take a look at you, and, okay, make sure that you're doing okay. Now, are you having any chest pain, any shortness of breath, any coughing,
No,
any
just,
any lower leg swelling?
Just be tired. Just
Just tired? No, no gum, like bloody gums,
Just
no,
tired,
no bloody
doctor.
noses, nothing
Just
like
tired,
that?
doctor.
Just tired, just tired, okay, that's
And
all
my
you're
pain.
saying. And
And
your
my
pain.
pain, yeah.
Okay, alright, we'll get to your pain, okay?
Alright.
Alright. Alright, so. Okay.
Is everything fine?
Yep, can you open your mouth? Can you open your mouth a little wider?
I cannot, I don't feel good.
Okay, but I need to take a look inside and
I
make
don't
sure
want
your
to look
mucous
at it.
membranes aren't
There's
like,
pain there too.
there's
Just
pain in
really-
your,
Yeah, I really need to talk about my pain.
okay, but can you give me a second so I can look in your mouth? If
No.
you've got tooth pain, I need to see it,
No,
okay?
doctor, I just can't do it.
Okay, alright, so I'll move on. Okay, look inside look at your eyelids here. Okay,
That hurts too, doctor.
your face hurts?
Mm-hmm.
Okay. Thank you, deep breath. Deep breath. Okay, breathe normally, listen to your heart.
Oh, that hurts too, doctor. Oh.
Okay.
Yeah.
Alright, but there's no lower extremity swelling or pitting edema, so that's pretty good, okay? No evidence of cyanosis as well, alright? So,
Cyanosis?
yeah, cyanosis or bluing, where your skin looks blue,
Why couldn't
okay?
you just say blue?
Well, it's a deprivation of oxygen, and so when you don't have enough oxygen in your blood or your red cells that aren't enough, they
How
get.
am I ever gonna repeat this back to my husband? I can't.
So what I'd like to do is I want to make sure that I'm going to send your iron to the pharmacy. I'm also going to send your Senecot to the pharmacy. I was unaware that you wanted to talk about pain today, so we're on unfortunately at almost the end of our visit.
But that's the most important thing to me, doctor.
Okay, so what's going on with your pain?
It's just, I can't, it wakes me up, I can't sleep, I don't wanna do anything, I don't go gardening. Why? Because the pain is always interfering.
Okay, now we did start you on Lyrica, correct?
And that's not working,
Okay, and you just have pain all over the place?
just all over.
All over, okay. So what I'd like to do then, I can increase your Lyrica dose, and I'll send the new script to the pharmacy.
But what about the one with the P?
The one with the P? So the one with the P, well, we discontinued it because we wanted to try something new, okay?
But that one works for me.
Well, remember, we only started you at the lowest dose of Lyrica,
Mm-hmm.
all right? And so we have to give it some time to work yet. Okay,
How
it's
much
only
longer
been,
do I need?
well, it's only been a week. Okay?
And I gotta suffer another week just
Well,
because you're
hopefully you
giving
won't
it
be-
time to work?
Hopefully you won't be suffering, okay? That's not the goal. The goal is not to make you suffer. The goal is to hopefully give you, okay?
When did you want her to come back?
In a week,
Okay.
okay?
All right. is your visit summary. This tells about your colonoscopy, the anemia, and she would like you to come back in a week. You can take this, go around the corner to the front desk, and you're all set, okay? Make sure you make your appointment.
But